Good afternoon and good morning. My name is Amneah Chaaban, and I am a student from the University of Michigan, Dearborn, here with my colleagues today.
Hello, my name is Hussein Bazzi. I'm a student at Wayne State University.
And today we are here on behalf of our colleagues to present the research project, Examination of Mental Health Indicators Among Arab Americans in Metro Detroit. Through going into this project, our colleagues and we decided that mental health is stigmatized greatly within the Arab American community in Metro Detroit. And with the stigmatization being at large, there's scarce literacy available on mental health indicators relating to the Arab American population, and that it is crucial to fill this gap in research to allow healthcare providers to better understand Arab Americans in the reporting of mental health symptoms.
With our research project, our overall objective was to study the correlation between depression and loneliness and the indications they can have on mental health, especially pertaining to the Arab American population within the Metro Detroit area.
To best survey this population and gather data, we decided that the best route would be to survey through an anonymous digital survey composing of two scales. The first being the DiM scale for emotional and social loneliness questionnaire, and the second being the Center for Epidemiologic Studies depression scale. And these scales were again digitally distributed. The DiM scale for emotional and social loneliness questionnaire was used as an indicator for overall loneliness. The Center of Epidemiologic Studies depression scale measures prevalence of depressive symptoms. We've seen overall that our data was collected of 255 adults age 18 and up. The data collection is made possible through the help of Arab American Health Initiative, the University of Michigan, and various social media outlets. The University of Michigan IRB granted exemption status for this study.
As we move along and look into our results, we can see that Arab Americans have a lower rate of depression and have a lower sense of loneliness than their non-Arab American counterparts. It's interesting to see that we found that more Arab Americans felt depressed than lonely. In trying to understand this, we came up with the conclusion that it could be due to the influence of the Arab American culture in which people are generally surrounded by large groups of family and friends. Along with this, we found that the percentages of mental health indicators are lower among the Arab American population when compared to the non-Arab Americans. A finding for this is that it's possibly due to related cultural practice like the emphasis on family relations and the support of community members towards one another. Another interesting finding, if you look at our graphs, is that we found moderately religious Arab Americans tend to be more lonely than strongly religious Arab Americans. In conclusion, there was a greater reporting of loneliness amongst Arab Americans who identified as religious compared to those who identified as strongly religious, and the opposite was true for non-Arab Americans. With our results and discussion, we came to a few impacts and conclusion. This information will serve as a resource for healthcare professionals to better identify mental health indicators amongst their Arab American patients. With this data and discussion and conclusions that we found, we also can communicate with religious centers to develop programs that help normalize conversations regarding mental health amongst the Arab American community. And given the stigma associated with mental health, we hope to provide a basis for initiating new studies and intervention for Arab American mental health all across the world.
And going and following that, we reflected on the data gathered and the results that we've discussed and decided the future direction of our project. The first finding that we found was that we would like to utilize the findings gathered from this research to facilitate better understandings of mental health indicators for the Arab American community in the reporting and treatment of mental health. We would love to work with local organizations who cater to the Arab American community to create educational programs for the Arab American population on the importance of recognizing and treating mental health. To develop programs that are targeted to addressing stigma within the Arab American community is our future goal as well. We thank you all for joining us today in learning more about mental health indicators among the Arab American community in Metro Detroit, and we wish you well.